Today we're talking about the all too common die-off symptoms associated with a Candida treatment. Now this is all clinical experience, so it's going to be very easy to talk to, but in the Byron Herbalist Clinic, when we're treating fungal overgrowths like Candida or even mold overgrowths actively growing in the body, sometimes the wheels can come off and patients can feel so much worse before they feel better. And this is a good thing in a certain way. Again, we have to navigate it. It's not great to feel worse before better. We got to get you feeling better and, the best cured. But it's a good thing because it means that we are most likely using the right strategy, whether it's herbal medicines or probiotics, fatty acids for Candida. You can learn more about that here. We're using it, we're hitting the bug's dying off, it's causing all these die-off symptoms for you because your body can't keep up, but we're just taking too much. So first off, common symptoms when we are treating fungal overgrowth, this is where things can really flare. People can experience it with SIBO, bacterial dysbiosis, definitely parasites. They can trigger a strong die-off reaction, but those fungal overgrowth patients, those Candida patients, they can really flare on the symptom front. And when I'm explaining it to patients, I say, look, it might almost feel like you're coming down with a cold or a flu, a bit of that viral presentation, and it never really kind of hitting, it never really happening. So commonly, when we roll into strong active treatments, patients might experience, not always, might. Some just roll straight through it and they're fine. They might experience headaches, brain fog, lethargy, sore lymph nodes, sore throat, looser stools, maybe even diarrhea, abdominal pain, gas or flatulence. And that might all be symptoms that they came to me looking for treatments for. So they'll roll into it and all those symptoms will flare and they'll be like, well, this is not working, drop it. We need to find something that is. Before you drop something that could get you better, let's navigate whether you're actually reacting to the product or whether it's a die-off. So the best approach here, and this really depends on your vitality and your tolerance, how sensitive you are. If you're super sensitive, then we pare it back just to one product at a time, low dose, and we start stacking therapies until we get this kind of full protocol under our belt. And we'll say, look, roll into all these guys at full doses. And if you experience any of those significant symptoms worsening, take a break, take a weekend off, get back down to baseline, and then reintroduce everything at half dose. If you reintroduce everything at half dose and you're fine, you're still dealing with those symptoms that you came to the clinic with, but you're you're not worsening on those symptoms, then keep building those guys up in unison until we hit the therapeutic dose. If you do find that as you ease in from that low dose up to therapeutic doses and the Herxheimer reactions, the die-off reactions flare again, no stress, no worries, drop it back down to the half dose, keep cruising, and then try it again at a certain point. This is where time is your friend, chipping away at the kind of foundation of those fungal overgrowths and getting a little bit cleared out so that you can ramp it up to the full dose. And if you find that when you do go from the low dose and you start ramping up, things just keep flaring, it gets a little bit tricky to work out. It's not tricky, it's just time consuming. We have to pare everything back to the foundations and start one product at a time, ramping them up. So the big concern, and this is where patients will come back to me saying, look, I am not tolerating this. There's something in this that I am not doing well on. And the way that I determine that is even at very low doses, maybe like a quarter of the therapeutic dose, if you are still experiencing strong die-off reactions a week, 2 weeks in, things aren't shifting, things aren't moving, you're not getting ahead of those symptoms, they're not shifting for you, I would be suspecting that you're actually reacting to one of the herbs, most likely. If we find for you that when we bring in something like oregano leaf or oregano oil, if we find that you start to kind of flare, we say, look, that's probably not your herbal ally. Let's keep it out, no stress. There is a whole list of herbal antifungals that we can work with instead. So I hope that helped. A lot about the die-off. This is mainly for the patients that I'm working with, but if you're dealing with those issues and you're trying to navigate a protocol, I hope that was helpful. Remember to like, comment, and subscribe, and we will see you in a future video.